Well, psychologists say they're bitterly disappointed by the government's decision not to extend extra Medicare rebated sessions next year. Patients can receive up to 10 subsidised psychology appointments a year through a mental health treatment plan. That number was doubled to 20 sessions during the pandemic. The Health Minister, Mark Butler, yesterday revealed that funding won't be extended beyond December 31st. That's despite sector advocacy to keep it going. He says an evaluation of the scheme pointed to inequitable access.
The evaluation found that these additional sessions had not had an appreciable clinical impact. As I said, the baseline mental health reported in the evaluation was almost identical between those who had received the additional services and those who had not.
For more, joining us live is Dober from the Australian Association of Psychologists. Appreciate your time. Thank you. From a healthcare perspective, what does that shift in policy mean for people who do need that extra mental health care?
In real terms, it makes it harder for people to access support when they need it. The government's own recommendation from the report specified that the remaining 10 sessions, the additional 10 sessions, should be reinstated. So it makes no sense to make access more difficult for people when they need support to access that support when they're going through mental health distress, because we know that when access becomes an even bigger barrier, that it is likely that their mental health challenges will continue to worsen before they get better, and we don't want that.
And when we talk about access, what is an average consultation fee? Are psychology sessions affordable for the general population?
They're not, and the report rightly points to financial access being the biggest barrier. So you're looking for about a 50-minute consultation averaging from $175 to $200, and the rebate from under Medicare for the majority of psychologists in Australia is $89. So that's a significant amount of out-of-pocket fees, which is why we at the API have been advocating heavily for the Medicare rebate to increase to $150 for all psychologists to help people get that support when they need it.
The opposition's been very critical of the timing here. Do you read much into that? We know that around the country right now, Australians are coping with natural disasters. This time of year is often a time of mental health hardship for many.
That's right. We find that typically December is an incredibly difficult month for many people who are accessing mental health support. And like you said, we've got climate change, extreme weather disasters that have absolutely smashed the country. We've got inflation and rising costs of living that are really stressing people out. And we also have next year not looking at this point in time to be any financially kinder to people. So a lot of people are stressed, and knowing that this lifeline to get support when they need it has been halved right before the end of the year. It's quite cruel, and to deliver this news has been really challenging for myself and many of my peers.
Carly, you heard the Minister justifying this decision just a few minutes ago. He was referring to inequitable access, essentially suggesting that the government wasn't getting bang for its buck in terms of those extra sessions that are being funded at taxpayers' expense. What did you make of that justification? Have you seen that in practice?
Before COVID even came or was known to us, wait lists in rural and regional areas were already blowing out. So the additional 10 sessions was phenomenal, but it wasn't going to actually meet all the needs that we know exist within the mental health care sector. And we take issue to this because we know that there is a significant shortage and wait lists across the country. And what we actually recommend is not only to raise the rebate for all psychologists, so more psychologists can bulk bill, it's to also mobilise the provisional psychology profession, because there's almost 8,000 provisional psychologists in Australia who would be willing and wanting to work under the Medicare system. And that would alleviate waitlist times, it would provide more feet on the ground to work in the sector. So we think that there are many more kinder, evidence-based fixes for the current mental health care crisis that we are experiencing. We don't think cutting these vital services is the way to go, especially when the government's own the report recommended otherwise.
And so when we look at the workforce of psychologists, broadly, do we have a shortage? Are you feeling the skills shortage crunch in your sector as well? And, how long generally does it take someone to actually get in to see someone?
We delivered our members survey, which showed that it can take from anywhere from 6 weeks to 12 weeks for people to actually move higher up on the waitlist to see psychologists, but also a significant amount of psychologists in Australia have actually shut their books because the waitlists are too long. So we have noticed a shortage of available psychologists, but this has also been tracking upwards over time. If you look at the recent ABS data from this year and the previous ABS data points about mental health, mental illness has been trending upwards for some time. So this is before COVID, this is before the bushfires, and we do not understand how cutting vital services will support these rates of mental illness to shift meaningfully and sustainably. So again, while there are not many psychologists who can accept new patients, we have almost 8,000 psychologists, provisional psychologists, who have done a minimum of 4 years of university training and are in their final 2 years. They are supervised, they are knowledgeable, they are ready to go. We promote that as one option to strengthen the mental health workforce to actually meet the capacity and demand that the Australian public need.
Carly Dober, I really appreciate your insights. Thank you.
Thank you so much.